It is called BA2, and it's a sub-variant of Omicron, and it has already been found to be almost twice as contagious as the original Omicron that tore through the country just a couple of months ago.
We're seeing increased activity in certain areas of the United States, but also around the world, they're seeing it even more so. We're particularly concerned about Europe because every time that Europe has had an increase, we have followed them weeks to a month or so afterwards.
In the UK, 82% of adults have had a third dose of a COVID-19 vaccine. In the U.S., that number is a mere 36%, and among Americans over the age of 65 who are eligible for a booster, 1 in 3 have not gotten that third dose.
Pfizer has just applied for a 4th dose for people over 65, with the idea being there maybe even another booster dose. But obviously for people that have only had 2 doses, they need to get that 3rd dose.
The United Kingdom's health agency found that effectiveness of the original vaccine series after 6 months against Omicron fell to 10% for infections, 35% for hospitalizations, and 70% for deaths. 4 to 6 months after a third dose, boosters were only as much as 50% effective at preventing infection and as much as 85% at preventing hospitalizations for all adults.
We're not seeing an increase in cases yet here in the United States, but that rising trend in BA2 is worrisome because that's what happened in Europe before they started seeing their cases and hospitalizations rise.
Dr. Bowling says don't wait until cases climb to get that booster because it takes several weeks for the effectiveness to kick in. Jeremy Baker, KENS 5.